Good afternoon. I'm your host, Dr. Festus High. Welcome to your doctor and you. Today, I want to talk about something that bothers my heart, something that put a lot of patients into big problems, something that have made some people, when they come to the hospital, the doctor finds it difficult to even know exactly what is wrong with them. Sometimes the doctor is giving treatment, they are not responding to treatment. Sometimes, in fact, they a little bit confused on what we need to do. Something that is vital, if done properly, is vital to making sure the diagnosis of your patient that comes to the hospital is made. I want to talk about lying to your doctor. It has become a trend these days where you see patients who intentionally come to the hospital and lie to their doctors. How do you lie to their doctors? Or let me ask you, why do you lie to your doctor? Some have given reasons. If I tell doctor the truth, he will blame me. He will curse me that I've gone to herbal place. I've gone there with my level of education. If I tell the doctor, some will say, if I tell the doctor where I've gone to, that means my bill finally will be very high. He will believe that I've gone around, I've not seen any help. So if I have to hide it, I will not tell him, I will lie to him. Some have different reasons why they say they should lie to that doctor. But let me ask you a question. Do you think lying to a doctor is the best thing you want to do to your own life? You can lie to your judge, your lawyer. The worst that will happen, you go to prison. But sometimes if you lie to your doctor, if you're not careful, you end up in the grave. And when you're in the grave, that is final. So the danger, and you say, I've seen cases that some people will come to you. They will tell you, there was a case I saw some time ago. She said she had never met with a man, that she's a virgin. Of course, thank God I do what I know, do my investigation. She came with severe abdominal pain and she was bleeding. She was pale. I just put my probe there, checked it was ectopic pregnancy outside the womb. So if you want to find that as a doctor, you need to probe further. Even when the patient is lying, you can still pick up information that you can. But what if this happens in a village setting or somewhere else where they don't have facilities to make diagnosis? What do? Some will come. Some will come. Especially those of them that are pregnant. They must have gone to do massage somewhere. A lot of massage. There was a case that came in about some months ago. She almost died. So went somewhere to do massage. They tried to force out the baby. They couldn't. They rushed to bring her to the clinic. So while I was taking history, I said, Madam, have you gone anywhere before? She said, no, the labor just started. Because if you come to a doctor and say, look, you went somewhere and they give you this, they call it hot drip. I know terrible things happen in this country. A lot of terrible things happen around us. All these maternity homes, from this traditional birth attendants home, they use this oxytocin that is a dangerous drug. We doctors use it with precaution. They call it hot drip. Say they give a hot drip. So if you had come to a hospital and you now told your doctor, like, look, sorry, I went elsewhere and they gave me this hot drip for some time, for 2 days, I'm in labor, what's happening? The doctor exactly knows what to do to help you at that point in time. But some of them will lie that no, the labor just started a few hours ago. And meanwhile, they've been massaging that tummy. There was one that came. I said, okay, we'll check, but I will not trust. Okay. As she just pushed, I don't know what, in fact, over time, the baby's head was in position. Before you know it again, as the baby came out, she ruptured her uterus. It was later on, that one took like 5 pints of blood in the tear. Thank God we had facilities around that could have helped us to save her life. She would have died. If she had delivered maybe in a village setting or something where there's no blood bank services, she would have died. Thank God we saved her life. So later she started telling us, doctor, actually I went to this place. They did a lot of, I don't know the kind of massage they massage the uterus to even weaken the wall or the strength of the uterus. Sometimes when they're pushing and come up with problems. Sometimes they won't sit on this woman's tummy. They use a lot of force to press it. I told you before, the womb is like it's elastic. It has a limit. It can do, over time, it can just tear like a paper, before the woman dies, if nothing is done. So if the woman had told us earlier that, look, then we have said, madam's like this labor, what we need to do is we don't need to waste your time, do a CS and bring her this baby. Although when we check, the baby's heartbeat was beating well, and so okay, let's just follow you through based on your history and based on what we are seeing, what we are examining. We know that she's done a lot of massage on that uterus. She would have died. Some will come, you are treating a patient, you give them drugs to take. Take this in the morning, this after this evening. They go to the home and throw the drugs under the bed. And the next time they come to the clinic, doctor, the drug is not working, I've been drinking. And the doctor will be wondering, why? I have given you, why is it not working? The doctor start thinking what could have gone wrong. So a lot of things. So what I want to say, so people, you can die, you can destroy yourself if you don't tell your doctor the truth. Don't be afraid that doctor is not going to charge you extra money because for telling him the truth. That's a wrong impression. Good, a doctor may want to be angry with you, but you are still his patient. He's going to take care of you, especially when you must have done what you ought not to do. Be free to tell your doctor the truth. If you've been receiving treatment all the while, if you remember the name, tell him it will because he's going to ask you the names of those drugs. Let me tell you, doctors are not magicians. The moment you present to the hospital, he looks at you after taking your biodata from the reception and the rest. They've done that. What would you do to you? It will ask you questions. Those questions are tailored towards finding the solution to the problem. Because from the question is going to ask you alone, about 80% of diagnosis has already been made from the question is going to ask you. So why lie to him? But if you lie to him, you must have misled your doctor. So what I want to say is that always tell your doctor the truth before you come to the hospital. When he asks you to tell him, there are some things he must have even forgot to say, doctor, hey, this is what I did, this is what I did. It will help you. Don't lie to your doctor. Some of them will come to the hospital, you must have drank so many drugs. And you tell say, no, I've not taken any drug at all. They will lie to you. If you tell your doctor the truth, number one, it will save you time. Your treatment will be quicker and better. The diagnosis will be easier to make. And of course, your life will be saved. Don't lie to your doctor. Lying to your doctor, if you're not careful, will lead you to your early grave. Well, I hope you must have learned something today. Tell your doctor the truth. He's there to help you at any point in time. He's your friend and he's your confidant. If you have a doctor that you cannot call your friend or your confidant, what are you doing there? Get your doctor to be your friend and your confidant and tell him the truth. Of course, he will always be there to take good care of you at any point in time. I'm your host once again, Dr. Festus Osai. Thank you very much and God bless.